Adeela.
Thank you, Ms. Anika. So I'm going to share proceedings of this 3 days international summit. The aim was the topic or theme was medical sociology and public health, and the aim was to highlight the relationship of medical sociology and public health in effective evidence-based education programs and health promotion practices. The focus of this conference was on the medicalization of human conditions, which have added to the broader understanding of social control and social order. I'm pleased to share some statistical information regarding the participation. 4 plenary sessions were conducted during 3 days conference, in which, along with 10 parallel scientific sessions, in which 66 papers were presented. Besides 25 international speakers from 10 countries, including USA, UK, Malaysia, Indonesia, India, South Africa, France, Spain, Canada, and Bangladesh, were also invited, and they presented very well. More than 600 participants across the world have attended different sessions during 3 days. I'm just giving you a brief overview of different significant events. Opening ceremony was held on December 2nd, although it was a virtual summit, but because of that, there's some invited guests from the Canada, we have organized this opening ceremony at campus. The opening ceremony was chaired by Dr. Saima Hamid, Vice Chancellor, and the keynote speaker were Professor Dr. James from University of Manitoba, Canada, and Dr. Noor Jannah from Indonesia. Whereas Dr. Nosheen Hamid, Federal Parliamentarian Secretary, joined us as a chief guest, and Major General Professor Amir Ikram, Executive Director, National Institute of Health, has joined as a special guest. The key messages derived from the speeches of keynote speaker and the chief guest is reflected like medical sociology and public health is concerned with the social attitudes and behaviors of individuals toward illness and health. It also established relationship of certain variables such as age and gender, role of norms, values, and cultural practices, relationship between health consumers and health providers, and role of health organization and institutions are important to taken into consideration in healthcare practices. As we are facing the COVID-19 pandemic, so the key message is also highlighted the COVID-19 brought for future prospects and the importance of public health, which hopefully will immensely increase in future as the pandemic is not over yet. As Dr. Saima Hamid quoted, during COVID-19, Fatima Nauman University has also achieved a huge milestone by disposing 500 vaccines in the past 4 months, along with in academia as they transitioned into an online teaching effectively through collaborative efforts. These 4 plenary sessions conducted during the 3 days summit. The first plenary session was conducted on theme medical sociology and anthropology. The speakers were Dr. Noor Azura Muhammadia from Malaysia. She was my PhD supervisor, Dr. Kamran Ishfaq, and Dr. Nazia Rafiq. The session was chaired by Professor Dr. Nematullah Hashmi. The key message derived from this plenary discussion, the sociological and anthropological perspective emphasize on preventive, curative, and rehabilitative aspects of health. It also emphasizes on the belief and cultural practices which influences the health and illness behavior. The role of sociologists and anthropologists is to spread awareness through mass education by seminars, campaigns, etc. Sociologists, moreover, are playing an important role, and quoting the title of Dr. Noor Azura, empowering the silence during the pandemic, building resilience for a better tomorrow. Plenary session 2 was conducted on mental health and well-being. And the speakers were Professor Dr. Zainab Sada, Dr. Faisal Rashid Khan, and Dr. Adeela Maqsood. The key message reflected mental health is an integral and essential component of health. There is a significant association of well-being with happiness, quality of life, life satisfaction, flourishing, personal growth, and life meaning. Mental health is fundamental to our collective and individual abilities as humans to think, interact with each other, and to earn a living and enjoy life. Third plenary session was very important session was conducted on COVID-19 and role of public health. Speakers were Dr. Farah Sabia, Dr. Muhammad Amjad Khan, and Dr. Said Ahmed. And the session was chaired by respected Dr. Saima Hamid. The key message derived from this plenary discussion reflected as health as a central role during pandemic or any other public event, and the role of public health during this pandemic is very important to address the means of COVID-19, multi-sectoral coordination, health prevention, health promotion, good governance, and workforce development must be well recognized, funded, and aligned with the guideline of international health regulations and WHO recommendations. Public health and social sciences playing a significant role in integrating the most in promoting social distancing. The government of Pakistan has also established the National Commander Operations Center, which is known as NCOC, for COVID-19 and all the workers and stakeholders under the Ministry of National Health Services Regulation and Coordination. The fourth plenary was conducted as a panel discussion on the very important topic, complementary and alternative medicine in the modern era. The panelists were Professor Dr. Anwarul Hassan Gilani, Dr. Raisullah Nawaz, Dr. Taiba Zainab, Dr. Hafiz Muhammad Asif, and the session was chaired by respected Professor Dr. Javed Asad. The key message derived as the traditional medicine sector has developed as an important source of healthcare, especially in rural and tribal areas of the country, due to a number of factors such as vicinity, affordable fee, availability, family pressure, and the resilient beliefs of the community. As we all know that Pakistan has a very rich custom to utilize medicinal plants for the treatment of various ailments. It requires the integration of the modern and camp system into the contemporary healthcare system. I'm quoting, let the complementary alternative medicines and functional food be the part of curing diseases and improving human health. So besides these plenary sessions, there were 10 parallel sessions on 10 different themes. The good and the unique perspective of these parallel sessions that these parallel sessions was joined by 10 international keynote speakers as well. Dr. Meher Mansoor, Dr. Amanda Messino, Dr. Razia Bhatti from UK, Michael Hirsch from USA, Rosilla Martin from USA. An excellent session was conducted by Rosilla Martin, Dr. Naveed Saeed, UK from UK, Mariam Bori from Spain and also living in the USA, Dr. Parveen Ali from UK, Shahryar Rahman from Bangladesh, and Janita Krishna from India. Here are a few glimpses from the online sessions conducted during 3 days. And I must acknowledge the sessions conducted by Ms. Rosilla Martin. That was an excellent session, reflected comprehensively on the sociological aspects of health and illnesses. I'm giving you a brief summary points of all the 10 parallel sessions, the papers presented in these sessions and the keynote speakers' talks. I'm giving you a brief reflection on those points discussed during these sessions. The field of medical sociology regularly interacts with the knowledge, sociology of science and technological studies. The focus on the medicalization of human conditions have added to the broader understanding of social control and social order. Moreover, public health has reached a crossroad that leads into two directions, a broad approach that addresses the social cultural foundations of health and a more narrow approach focusing on more proximal risk factors such as individual lifestyles or health risk behaviors. Countries with the poor health conditions find it harder to achieve sustainable development goals. whereas economy provides an important toolkit for meeting these challenges across a wide range of problems and settings, ranging from how taxes and subsidies might be used to promote healthy communities through changing the way healthcare is delivered and the ways providers are paid. Understanding the basic economic principles that apply to healthcare may also increase workforce mobility and improve the ability of labor, in that way improving efficiency in healthcare. Moreover, I must acknowledge and edit that point that Houston Tillotson University developed the Community Engaged Research course in 2019 as an extension of undergrad research initiative. The course curriculum includes training in scientific and sociological research methods focused on unique version of community-based participatory research developed by Meyer called the CARE model, and a repeating thematic thread of combating bias in data and research, which is a valuable addition into the medical sociology and public health. COVID-19 and role of medical sociology, total approximately 21 articles or papers were presented on the particular theme on COVID-19. So that reflected sociology and public health has a very strong relationship with each other in creating a healthier and sustainable environment in the current pandemic. We cannot ignore the impact of COVID-19 on healthcare workers as the frontline workforces due to which they experienced both physical and psychological pressures, as an increase was witnessed in the rate of positive cases, death rate, heavy workload, inadequate personal protective equipment, feeling lack of support, stigmas in community, and concerns about family and fear of being infected. Lastly, we have derived some policy recommendations, which somehow some points were reflected in the parallel sessions, and some I have derived and I have created after reflecting on all the 3 days proceedings. The policy recommendations are affordable, efficient, and equitable integrating system of healthcare is required to be and should be highlighted in health policy. Public health courses are required to be added in academia at all levels. An interdisciplinary public health discipline is also the need of a time to be established in leading higher education institutions to promote public health perspective as well as to produce more public health professionals. Here, the sociology department and the medical sociologist can play a significant role. The biomedical practices must be understood in relation with the socio-cultural determinants of illness behavior, the relationship between doctor and patient, medical organizations and bureaucracy, introduction of Western medicines into traditional societies, epidemiology, and mental health. A community health assessment can help with developing a community health improvement plan by justifying how and where resources should be allocated to best meet community needs. Credible and authentic media text making and dissemination in various formats of media and communication can be made possible for creating resilience in the domain of public health. Last but not the least, interdisciplinary research studies should be conducted to explore and promote the holistic perspective of health and illness. The final thought is, and that is a wish to establish healthy society by promoting awareness and knowledge of good healthcare practices.